This last installment of Altered Mental Status will talk about strokes in specific, and it will end with the drug Benadryl. I hope you enjoy. So now we're going to talk about a cerebrovascular accident, or another way of saying a stroke. Stroke is nothing but a death or injury of brain tissue due to a lack of oxygen. It can either be ischemic or hemorrhagic. Ischemic comes from a blockage of an artery, and hemorrhagic comes from a rupture of an artery. So signs and symptoms of stroke are obviously altered level of consciousness, aphasia, and there are different types of aphasia. There's receptive aphasia and expressive aphasia, basically saying that the patient can understand what you're saying, but they're not able to speak in normal terms, or they just can't do anything at all. Unilateral weakness or paralysis, so weakness or paralysis on one side or the other, unequal pupils, headache, and hypertension. How do we know if the patient is having a stroke? Well, there's two different methods to figure that out. One is the Cincinnati Stroke Scale. It consists of three different methods. One is facial droop. You look at the patient or ask them to smile, show you their teeth, and if one side is drooping over the other one. The next is arm drift. You hold the arms out in front of them, have them close their eyes, and let go of their hands. And if one side's droop more than the other. The last one is speech. You can have them say a simple phrase like, "You can't teach an old dog new tricks," and see if they can speak that in a clear sentence. So the next method is the Los Angeles Stroke Scale, the LA Stroke Scale. This one is similar to the Cincinnati, but it goes slightly more in depth about their history and things like that. Number one is their age greater than 45. Number two, do they have a seizure history? Is the symptom onset less than 24 hours? What was their ambulatory status prior to this event? Is their blood glucose between 60 and 400? And then it goes back to facial droop, arm weakness, and grip strength. So now we're going to talk about a TIA, or a transient ischemic attack. Some people will also call it a mini stroke. Most of the time they have the exact same symptoms as a full-blown CVA, but they usually resolve in 24 hours, usually less than that, sometimes even before EMS or the fire department arrives. The thing about this is if they do have a TIA, they have an extremely high risk of having a full-blown stroke and need to be evaluated for that. So the treatment of a CVA is based upon your rapid field diagnosis. Now it doesn't matter whether you use Cincinnati or LA. Most pre-hospital providers will use a combination of both to figure out if the patient actually has a CVA. Also ruling out other things like seizure activity, hypoglycemia, things like that can mimic a stroke. So we're going to apply oxygen therapy and rapid transport. Another thing is to notify the hospital early so the patient can get in and get to the CT scanner so the doctor can figure out if it's ischemic or hemorrhagic stroke, because the treatments vary depending on which one it is. So now we're going to talk about Benadryl. The generic name for Benadryl is diphenhydramine. Its classification is a histamine blocker. Indications is basically an allergic reaction, mild allergic reaction. Usually you're going to have hives, rash, maybe some difficulty breathing, some angioedema, which is swelling of the face. You can also have swelling around the site of whatever that caused the allergic reaction. It can be at the hands, feet, obviously face, anything like that. And one of the most common signs is hives or urticaria. So the next following pictures, you can see different various forms of hives and how they look on the body. So the dosage for Benadryl is 25 to 50 milligrams PO. So that's orally. So obviously the patient has to be able to swallow and is conscious. Contraindications is relatively low if they're allergic to Benadryl, obviously, and if they're having an asthma attack. Now, asthma is a relative contraindication with Benadryl, but you need to be able to discern between an asthma attack and an allergic reaction. Usually the evidence of hives and things of that nature will tell you, but if you give a Benadryl to a patient that is having an asthma attack, you can actually make it worse because Benadryl can increase mucus production.